Well, good morning, everybody. My name's Rob Kusserow. I want to thank everybody for your time and joining us today for our Telehealth Strategies webinar. Looks like we've got a lot of attendees. So again, thank you for joining us. We really appreciate your time. Just so you know, along the way, just a couple of housekeeping things before we get started. We've got several WELL employees with us answering questions today during the webinar. So you'll see on your control panel, the questions section, please feel free to ask us questions at any time. We'll have people answering questions through the webinar. Also, documents. We do have two documents attached. They're handouts. One is our telehealth playbook. That's what this webinar is based upon. We're not going to go into specifics on the actual verbiage of a lot of the automations we're recommending today, but they are available to you in that playbook. So we do recommend you download that. Also, we have a handout of telehealth resources. With that, let's get going. My name, as I said, I'm Rob Kusserow. I'm Director of Client Success here at WELL Health. I think most of you are familiar with WELL. WELL is a communication tool to connect your business to your patients. WELL is really a tool to direct the patients to the right resources, and today that resource is telehealth. A little bit about my background. I've been with WELL for about a year now, just a little over a year. Prior to that, I spent about 4 years in the telehealth industry at MD Live, where I was Senior Director of Client Success. I managed large health system accounts through the Midwest and also a team of client success executives. Joining me today on the webinar is Alex Hoholik. Alex, good morning, and I'll let you introduce yourself.
Good morning, Rob. Hi, everyone. My name is Alex Hoholik. I'm a client success executive at WELL. I am coming up on a year with WELL Health. And similar to Rob, I also previously worked at MD Live, a telehealth company, and I worked specifically with large health plans, ensuring that their members were taking advantage of the MD Live telehealth offering. Really excited to be here today. Thanks, Rob.
Thanks for joining me.
All right, so let's kick us off with our agenda today. Want to start and just lay out what we're going to be covering. And the first component is going to be what's at stake. We understand that this is definitely a difficult time, and there's a lot of stress for our clients, a lot of you that are on the call today. So we definitely appreciate you taking the time to listen and be open to some of the ideas that we have. A couple key items to hit on, though, is the reality of the situation and how it is impacting the health of a lot of individuals and also the health of your staff. So ensuring that you and your teams are able to effectively provide care to patients, whether it's related to COVID-19 or not, in a safe and effective manner. And the other key item here is revenue. We are seeing, as we'll show in more detail, more cancellations and clinic closures as a result of COVID-19, and that directly impacts revenue. So we're going to get into both of those items today.
Thanks, Alex. So the opportunity. So what can we do about this? So despite the crisis, there's really an opportunity to continue to care for your patients. And I think the best way to do that is driving to remote appointments where appropriate. So using telehealth. And in order to do that, we wanted to share some best practices around how to convert appointments, some things to think about with onboarding patients, getting them over to telehealth. What do you need to think about for your staff? What do you need to think about for your patients? What type of education goes with that? And then, of course, there's going to be certain appointments that just don't make sense to do a telehealth visit, and you may just want to postpone certain appointments for a period of time. And we'll talk about how we can help you reschedule those appointments that are not appropriate for virtual care and how to get the word out when you will be ready to reschedule those. And then we'll wrap up with the Q&A if we have time. All right, I wanted to start with this slide. Oh, Alex, you're welcome to do this. Look.
Nope,
doesn't matter. We both know this one. So just folks, if you were on the webinar last week, you probably recognize this slide. It really is just kind of a high-level reminder of our product and some of the tools in the tool set here at WELL Health. So campaigns. broadcasts, automations, and just a high level what those look like. Is a campaign is a message you push out, so if you're not familiar with a campaign is a message you could push out one message really to everybody. And where that can be used is if locations are being closed. Patient education is a great way to use that. Broadcast. So broadcast is another method. A use case for a broadcast would be sending maybe some information to let patients that are coming in that are scheduled for the next week, letting them know that they have the ability to change that appointment to a telemedicine visit. So a broadcast is one message to many people. And then lastly, an automation is just kind of a one-to-one message. So automations would be appointment reminders, or maybe letting a patient know that their upcoming visit is a telehealth visit and maybe some instructions on what to prepare for. So some information that we're just looking at is a group earlier today that I think is really important to share. Why telehealth is, of course, other than the obvious, why it's so critically important now, and why some of this messaging we're going to go into is so important is Sage Growth Partners just released some data on telehealth. And in that information, they showed that only 25% of respondents have actually used telehealth in the past, and more than a third of consumers, about 35%, aren't even sure if they have telehealth as a benefit. So really important when it comes to patient education. Another important number is, according to Becker's, of the $2 trillion stimulus package, 185 million of that is really slated and targeted for telehealth at critical access hospitals. So it really is a great time to be focusing and talking about telehealth. And as just a reminder, what we're going to cover today is best practices that we're seeing with our health system partners that have implemented some of these things, but it's always a best practice to run any of this by your compliance team before you implement any of these or deploy any of this to your production environment with Well or another product if you have it.
Perfect. So as I mentioned, we're going to talk about what's at stake and what we're seeing happen as a result of COVID-19. And a benefit of us being at Well and having a client base that spans the nation is we are in real time seeing not only direct responses from patient populations, but then again, in response to that, how our clients, how health systems, clinics, whatever type are responding to those changes in appointment interest. So the first thing I want to call out is that we are seeing a pretty drastic increase in requests to reschedule and cancel appointments as of this past week. So you can see that 63%. Obviously, this is a result of fears of being out and about with coronavirus, requests and mandates by government for shelter in place. So people when it's not urgent or not mandatory are looking to reschedule or cancel that appointment. And then obviously in the event of a clinic closure, those appointments need to be rescheduled or canceled as well. So in response to this cancellation, we are seeing our clients driving that virtual option for patients to recapture and avoid an outright cancellation.
So this slide is interesting because if you take a look at the left-hand side, this is a visual of inbound and outbound communications with Well customers and their patients. And so pretty steady over time up until March 2nd, and then it just went crazy, right? So it's a time of uncertainty. Patients want answers, and so we're seeing very large increases in health system messaging proactively going out to patients, and then as a response, inbound volume of patient messages, questions, cancellations, requests to reschedule is just skyrocketing. In fact, what we're seeing is, if you're familiar with the Well product, a patient channel is that communication channel between a patient. So that's really doubled in the last 2 weeks. So Well is a great platform to communicate with your patients, again, through those campaigns for mass education and awareness, automations and broadcasts for converting appointments to virtual care. And then one thing we're also going to talk about is inbound keyword automation. So you can start to close some of those patient channels for messages that you don't need your staff to look at. Because again, if volume is doubling, the inbound volume of messages is doubling, Many of those are just patients saying, thanks, got it, okay, and we don't need your staff to look at those. So we'll go into some details, and our team is here to help you create those types of inbound automations to close the channels you don't need to look at. So really overall, well tools allow you to communicate with your patients in real time or in an ongoing and scheduled basis.
So as our clients are out there communicating more about the virtual options that they're now offering, whether that be phone or video alternatives to in-person visit, in response to that, we are seeing a 20-fold increase in conversations between patients and staff around finding and scheduling these virtual appointments. So as you can see, a drastic change from February to March. Now, as Rob mentioned at the beginning, or towards the beginning of this presentation, although telehealth is very much a viable solution for care for specific event types, it's very much in its infancy, and the awareness definitely needs to grow to make sure your patients are aware of this option. And it's something that industry has been very focused on driving, even when we were at MD Live, trying to drive that awareness among either health plan members or health system patients. So this is absolutely a turning point in the use of virtual care, and definitely something we as a communication platform want to help our clients communicate and spread awareness among their patients.
Thanks, Alex. And on this slide, really, as I said earlier, we've seen an increased inbound cancellation requests, and reschedule requests from patients. But the good news is what you're seeing here is there's also a corresponding increase in scheduled telehealth visits. On February 29th, a couple of important dates on this slide. So that was a date the first US death took place for COVID-19. At that time, we saw health systems partners start to message patients asking if they wanted to convert upcoming appointments, on-site appointments, to telehealth. The result was okay. You can see that kind of an uptick in virtual visits started to happen, and that continued through the 11th. But then on the 13th, March 13th, that's when the president declared a national emergency. At that point, was very distinct. We saw health system partners start to change their strategy. Rather than asking patients, would you like to change or convert your appointment to a virtual visit? What we saw them do was take a look at specific event types and convert them automatically. So what that means is they were just going in and canceling the appointments, cancellation note automations went out to the patients, and they immediately just went ahead and rebooked that appointment as a virtual visit. And that's where you're seeing this sharp increase in virtual visits here on this page. Result was 15-fold increase in virtual appointments, really from March 13th up to the 24th.
Fantastic. So with all of that being said, we know the scenario, right? We know where we are. It is a difficult time, but Well wants to reinforce the fact that we are here for our clients to ensure you're getting appropriate communications out and maintaining appropriate appointments where appropriate, and triaging and keeping potentially sick people out of your facilities. So we're going to shift gears a little bit and start to talk about the actual ways that Well can support our clients and some use cases that we are actually seeing implemented to date. So just at a high level, the things that we will touch on are proactive outreach, so engaging in spreading awareness, incorporating appointment reminders. So obviously today you have appointment reminder workflows for your in-person visits, but they are very easily replicated and can definitely be added onto to support virtual visits. Onboarding, how do you educate people how to use a virtual tool, whether that's a phone call, a Zoom meeting, or a specific telehealth provider. And then finally, sorry about that, your help desk. How do you help give guidance to your patients as they are learning a new tool? And how do you set those individuals up in Well to be able to effectively triage and help answer questions and get patients the support they need in a trying and stressful time? So at a high level, again, these are the topics we'll cover. As Rob mentioned earlier, please check out the white paper in the handout section, as that gets into some specific verbiage that can definitely be a template if this is something that you'd like to pursue.
So where do we start? So I think a couple of things. Prior to going in and converting appointments to telehealth, we need to consider a few things. One is, do you have a telehealth event type in your EMR? I find some health systems do, some health systems don't. And then if you do you have both telephone and video? Do you have those two different types? So having those in place is really going to help you manage changes to your automations and your patient communication. So that's the first step, is creating that telehealth event type or event types. The next thing is, do you know what type of appointments you want to convert to telehealth and that are appropriate? So this is going to be a business decision, really, I think, where you need to sit down as an organization and just kind of weed through and comb through those event types and look at those, because there's really going to be some that qualify that could be a virtual visit. And then you need to decide, of those, do you want to keep some of those patients coming in for those? And there may be some that you just want to automatically convert to virtual visits. And then there's also going to be some visits that just don't qualify for virtual visits. And of those, there's really two subsets. There's of the ones that don't qualify for virtual visits, you may still want patients to come in for certain visit types. And then there are going to be some that you just simply feel that it's better to reschedule those for a later date. So you need to start putting together these strategies, but we recommend the strategies be based upon these different visit types. So making a business decision, what are you going to do with these four kind of buckets of visit types, and then how do you manage those? Of the ones that are going to be rescheduled, a couple things you can do. You can use broadcast to reach out to those patients to either ask them, so two trains of thought there, ask them if they'd like to reschedule it, or just go ahead and convert it, and then that would be managed more through an automation. Just some quick examples of a broadcast. It might be something like, for your convenience, we're offering you the option to switch your appointment to a video or a virtual visit. Be assured we're doing everything we can to take every precaution for your safety. And you might even use some inbound keyword automation. So saying something like, please text back #virtual if you'd like to switch to a video visit. And then what we can do, we'll go into this in a little bit later, but you can create inbound groups, if you will, so where people are in your organization are being tagged. So if a patient texts back #virtual, you have a group of people that are there to very quickly see those messages and then take action based upon what your workflows are. You may also want to send out some mass patient communication. And again, those are going to be campaigns. An example of that would be, one of my health system partners actually just did this yesterday or the day before. They made the organizational decision to close all of their dental offices, with the exception of seeing patients for qualifying emergencies. So their campaign was to any patient that had had a dental appointment at their organization in the last 12 months, letting these patients know that all dental procedures are being put on hold temporarily. Someone will be reaching out to reschedule their appointment, and letting them know that if someone had, say, a fractured tooth, infection or swelling, or severe dental pain, to please respond back either #dental or to call in. So letting patients know what to do, say, for an emergency situation, if their appointment's been canceled or if the office is closed. Another thing I think we need to think about is, how are we going to respond to patient requests to reschedule or to cancel their appointments? Some things you can do there is set up some quick responses so that your call center or your front desk agents are very quickly able to get through these patient responses. You can also use inbound keyword automations, like we talked about, #dental, #virtual, that will either take specific actions in well or send messages back based upon whatever your workflows happen to be. Also, the other thing you can do is, I'm trying to think, Alex, there's one more item and I'm forgetting what it was. So inbound keyword automations, quick responses, and it'll come back to me, guys. Sorry, I'm drawing a blank on my third item there.
No worries. You can always interrupt me if you want to throw it in at a slide.
I appreciate it.
Um,
Thank you.
Perfect. So switching gears just a little bit more. So converting and moving patients to that telehealth event type or that virtual event type, whether it's telephone or video, whatever that might be. It definitely helps to have a team, whether that's your scheduling team, a front office person, someone that's actively working in the clinic, to be available to triage specific questions that we know are going to come in related to a telehealth appointment. A couple ideas on how a specific telehealth user group could be used. One would be to triage for symptoms. If you have an appropriate MA or person that can ask and has specific processes and questions to work through, that can definitely help identify if a patient should be going to the emergency room or if they are eligible for a telehealth visit. As Rob mentioned, another option is to have those keywords. So whether that's virtual care or help, symptoms, or just updates, you guys can use that to trigger automated outbound responses to patients. So if someone is asking about a virtual care appointment, that could immediately trigger an employee to go in and schedule an appointment. Help will definitely be a great resource, as I mentioned, with building awareness of a new platform, with helping patients get into a webinar, let's say, or if you're using Zoom, it might be the first time this person is using Zoom, and you want to make sure that they have the app downloaded and that they have their audio set up and that they're not on mute. Things like that, giving those patients guidance can be very helpful. Also, symptoms is another option that I talked about, so that triage, and if they have specific questions around how they're feeling, getting them to the right resource. And then also hashtag updates. If you guys have, what's the right word for it, mass updates that you want to automatically send to patients, whether that's a clinic closure or hours of operation or changes in location of appointments, those can be created as automated responses to go out to patients if they send in a hashtag updates and you're encouraging them and educating them on how to do that. So another thing to consider is post-appointment follow-up. In most of your probably current workflows for in-person visits, you have some sort of thank you message or potentially a no-show message that happens after the appointment has been completed, potentially a day, maybe 2 days after, and when that patient's status has changed. That is absolutely something to still replicate with a virtual visit. Just because they weren't in one of your facilities meeting face-to-face with one of your providers, closing the loop for that patient is still key, especially when a patient is trying a new technology in a form of engaging with your providers. So this post-appointment follow-up for a phone or video visit would definitely be twofold. One, thanking them for using a telehealth visit during this time, but also highlighting that if them or a family member or even a friend or coworker experiences similar symptoms, that a telehealth visit is available to them too. So continue to spread awareness of this tool to, again, continue those efforts of regaining a potential reschedule request or a cancellation and getting that appointment completed virtually when that's applicable.
All right, I'm gonna go, I know you touched on some of this, Alex, on your last slide, but I think it's really important. So I'm gonna go into a little more detail on onboarding, and what we mean specifically by onboarding here is onboarding patients to virtual care. This goes back to those numbers that I gave you earlier, that most patients don't even know if they have a virtual care benefit. Actually, let me tell you a quick story. So I went to work for MD Live, 5.5 years ago, and it was one of those situations where I chose not to get to carry my insurance from my last employer. So I started with MD Live. I didn't have insurance, and it's going to take 30 days for the insurance to kick in. So what happens? I get sick about 10 days into my new job at MD Live. And Alex, it might have been you, but I was commiserating with one fellow employee at MD Live about how, oh, it was me, I'm sick and I need to go to urgent care and it's going to cost me a fortune because I don't have insurance. I worked for a telehealth company. It didn't even dawn on me to use their services. So, I mean, again, that kind of goes to show either I'm really stupid, which may be, or we just don't think about telehealth. A lot of people don't think about it. So some things we really have to think about is kind of guiding these patients into the telehealth world. So with that, what do we want to do? We want to help them with pre-visit. So that could be things like download instructions. So where do you find the app? How do you download it? When do you download it? Do you need to sign in for the first time? What settings are important? Some things that we found at MD Live that were really important is teaching patients how to test their audio, test their video, make sure that they're in a well-lit room rather than being, in a dark bedroom. May not be inherently what they want to do if they're not feeling well, but at least have a light on, especially if there's going to be video and the provider may need to see something. You probably want to consider doing some additional automated reminders. So if you're with Well and you already have your inpatient, your in-house automations built, many of those are going to be very similar for video visits, but when it comes to video visits or telehealth visits, phone or video, I guess, there's really some other things you want to think about. What we found is as some of our health system partners have started to convert patients to virtual visits, they've still had some patients show up in the office because they forgot. So what we're finding is health systems are sending out a new reminder about 2 to 4 hours in advance of an appointment, really just to remind that patient that it's a virtual visit and then maybe of any specific instructions. So reminding them again to download the app and things like this, just preventing the patient from hopping in their car. The other thing is we're seeing health systems send out another reminder, maybe 5 minutes, 10 minutes in advance of that appointment, especially if it's a telephone visit, because we are so used to not answering our phone in society today that it's a really good reminder to let that patient know if it's a phone visit that they should be ready and be expecting a phone call from, maybe even giving them that exact number that the number will be coming from so that they're prepared. Or again, it may be telling that video visit person or patient to launch into the visit 5 minutes in advance. So those are some things to think about pre-visit. We also want to share expectations for what the patient should expect during the visit. So that means sending some specific instructions to the patient for things that might not be common for an actual in-person visit. Things like what happens if the doctor's running late? So if we're seeing this big spike in virtual visits now, that means doctors may be running late. They've got a lot of appointments, some may take longer. So we need to have processes in place and share those with the patient on what happens when the doc runs late. Do we want them to text in? Do we want them to hang on? Will we be calling them back? Things like that. Also at MD Live, one of the biggest things we found was patients would run into technical issues. Typically just the first time, anytime you try something new, it's different, you don't know what the process is. So we want to have a process in place. We recommend that you have something in place where if the patient can't connect, or if the audio doesn't work, or they get connected with the provider and then the call gets dropped or the video gets dropped, how should they contact you? How should they reconnect? One of the things that we saw at MD Live was video visits specifically would get started, a patient may get disconnected, and then they would dial back in and get a different provider. And depending on what your workflows are, this may or may not happen. But then it became confusing because you had multiple doctors. You had a new doctor that was talking to the patient while the old provider was trying to reconnect with the patient in the first place. So we want to think about those things in advance, communicate with the patient. For instance, if they get dropped, maybe they just type in #help, and that goes to a technical group of users that can help that patient, guide that patient through the process of reconnecting with the provider. Post-visit, so probably want to communicate some things like e-prescribing. They'll still pick up their prescription at their normal location. If you're able to send the information when that prescription is ready, that would be great. And then I think really importantly, especially if that patient has a positive experience, have them tell their friends and family about the experience, so that, again, they can let people know that even though in the current day, state, and time and craziness that we're seeing in the world, patients can still, for the most part, seek care. There's just a new way that we're going to do it for, the next couple of weeks or months or however long this takes, but have them share their experience with virtual care. And then you should have a much greater adoption of virtual care as you continue to move those appointments over to telehealth.
So as Rob mentioned earlier, not everyone and not all appointment types are going to apply for a virtual visit, whether that be a phone call or a video. So how do you handle individuals that aren't eligible or even that opt out and just say, nope, no thanks, I prefer to be in person with my provider? So for anyone that's ineligible, definitely still engage with them. This could be more appropriate for a campaign or potentially a broadcast, but reach out to them and coordinate a time to reschedule that appointment. Now, I know that the dates of clinics opening or shelter in place rules, when those will be lifted, that might still be unknown. But if you have a date in mind, just let patients know that you will be rescheduling specific event types a couple weeks out, a couple months out, whatever that is, and ask them for available times in that date range that work for them, and adjust that appointment and keep that on the books. Also, always making sure to let potential ineligible patients or appointments know if they can still come in to the office for their appointment. On the other hand, if a patient just outright declines, obviously want to continue to promote and have communication with those patients. So it's okay if they don't want to leverage a telehealth alternative, but definitely continue to send, if you're going to do any campaign communication to educate and drive awareness of telehealth, ensure they're included. And then also make sure that they know as well the time frame by which they can reschedule that appointment that they would prefer to do in person. So for anyone that declines, continue to make them aware of the offering and also look to reschedule, again, avoiding that outright cancellation of the appointment. So we covered quite a bit today, but just to do a high-level recap, this is a very unique and interesting and chaotic time. And as I said, in real time, we're seeing patients respond to new changes in lifestyle, and they are canceling appointments, or they're asking to move appointments, and they're sending in more questions related to their health and specifically COVID-19. In response to that, we're seeing our clients move to virtual care and offer phone and video visits so that your providers can still give patients care, but do it remotely to protect their own health and also the health of patients. With all that being said, WELL is here for all of you. Our communication platform is intended for use cases just like this. We're not a telehealth platform by any means, but we are there to drive that communication and awareness of a variety of tools between you and your patients. So normal conditions and in-person visits, as you all are familiar with, you have a standard automation workflow. But with adding new event types, as Rob called out, and highlighting this population of appointments, we can still build an automation workflow and automate this dialogue between you and your patients under crisis conditions and promoting those virtual visits. So hopefully you learned a few things today with all that we've covered. And so just to highlight here, if you guys do have any questions, if you want to reach out to support@wellapp.com, if you potentially aren't a current Well client, please reach out to well@wellapp.com. And I think we're going to do some time here just to triage some Q&A.
Yes, thanks, Alex. And also, just so you know, we anticipated that we might have some questions from people that would be around compliance or security, things like that. So we do have a guest star today for the Q&A section. Sam Joe, welcome. He is Wells' lead on compliance and security. He plays a key role in HIPAA, high trust certification, and does a lot of strategy with our strategic accounts. So Sam, welcome.
Perfect. Thank you, Rob, and thank you, Alex, as well. And yeah, based on our remaining time, we may only get to a few of the submitted questions, but we have selected a few that we think are representative of the areas of the highest interest. And if we don't cover your question, we will follow up directly. And as always, you can reach out to us at support@wellout.com, and we will make sure that we get your questions addressed. So to jump into the first question, which is actually a regulatory question, which patient populations can be converted from in-person to telehealth visits and still be reimbursed? So this is a great question. And during the crisis, so there are broad expansions for all Medicare beneficiaries. Before there were restrictions based on factors such as being located in a rural area. Now telehealth services are open to all Medicare participants with parity for in-person visits. An important factor, Medicaid telehealth expansions are state by state, and payer policies are also payer specific, but with both Medicaid and payers, we're seeing that they're following suit of some of these CMS expansions for Medicare. So with payers, with UHC, Blue Shield, Aetna, Humana, we're seeing expansions for telehealth kind of across the board, but it is a good idea to have a step to check and confirm based on your patient's eligibility and have that step in there. Going on to the second question. So can you walk me through the workflow for telehealth user groups? Specifically, how can I triage a telehealth reschedule or a telehealth help support to the right person? So I think this is a great question. And Alex, you had touched on this workflow, but I think this is a good one to go through again, as it's, we've seen it's had pretty high impact. Maybe Alex, if you don't mind, if you can walk through again the workflow to help us understand, I guess, how an inbound text with a keyword would get triaged appropriately and how some of those conversations could occur.
Absolutely. So reading those inbound messages and picking up on keywords and phrases is all done with what we call an inbound keyword automation in Well. It is similar to where you're creating your automations and your configuration settings, but as opposed to being an outbound appointment reminder, this is actively looking for specific words and phrases that your patients are sending in, and then taking one of several actions from there, whether that's tagging an internal team or person, or if that's closing a channel, confirming an appointment, or sending an automated response. So in this instance, what we would look to do is either within the user groups in your practice settings or in the user groups in your enterprise settings, create a group, telehealth support, whatever you want to call it, add the specific individuals you want to have support triage those questions, and have that user group created. Then develop an internal mention that is set up to create an internal mention to that group if a patient uses a key phrase, whether that's COVID-19, coronavirus, technical issues, whatever it might be. And then once that inbound automation is set up and turned on, that will then start pinging those specific individuals to receive and address those mentions. It's very high level, Sam, and there's a lot of details that go into actually setting that up. So as we mentioned, support@wellapp.com or your specific client success representative can also help you walk through those steps.
Perfect. That was extremely helpful. Thank you, Alex. Moving on to the next question here. Should I send a note to all patients letting them know of telehealth services or just patients who have appointments coming up? So Rob, I think this touches on some of the items that you went through in regards to proactive outreach. So I guess based on what you've seen, any recommendations on who should be notified for telehealth services?
Sure, and that's a really good question. It really is going to be based upon business decisions that you would make, because there's no right answer here, because it really depends on your business, right? It depends on how many. I would first look at how many of your appointment types really could be converted to telehealth. If that is a large amount, a large volume of those could be converted, then it probably makes sense to go ahead and reach out to that entire patient population just to let them know. That's going to let them know of current appointments that could be converted, as well as if they're planning to make appointments coming up, they might instead consider to make it a virtual visit. Now, if you're in a line of business where not so many, you don't have that many appointments that would qualify to be a virtual visit, then you probably don't want to go the campaign route, but probably better to go that one to some method. So of using a broadcast, or really limiting, you still could do a campaign, but probably want to limit it, or even just use automations for those specific appointments that you're wanting to convert. Again, and if you've got questions, reach out to Client Success. We can help you determine what the recommended path would be.
Perfect. Awesome. And then the next question here, are there instructions somewhere for setting up the inbound keyword automations? So I think this is just kind of a general good item to address in terms of where you can find support for an item like this, or other items in terms of configuring well. Rob, do you want to help direct where the best place would be for that?
Yeah, absolutely. So a couple of things. We do have a support article on our support site. We can send this out actually after. We should be able to send it out as a recap with instructions or a link to that. But the other thing is, if you need assistance, our team does this all day long. So just by sending in an email to support@wellapp.com, letting us know that you would like to build that, we're happy to help you out with that. Or if you have a designated client success executive, reach out to them. I've been doing this all week, just kind of building these automations for customers, letting them review them and them turn them on. But we can very quickly help you build those, or do it ourselves if you're too busy right now.
Perfect. And then I believe this is the last one we'll be addressing today, but for those using Zoom, are clients using the platform without a contract with Zoom? So we know a lot of our folks are quickly, very, very rapidly deploying out telehealth technologies to help support these services. While we don't know the specifics around whether they're going into contracts or not, what we do know is that the HMS has recently released waivers regarding technology platforms and non-HIPAA compliant technology platforms that you can use during this crisis, specifically a waiver where the OCR will not be penalizing any of the providers during this time for different technologies that you use that otherwise may not be HIPAA compliant. Zoom specifically, I do know they do offer a HIPAA compliant solution, but in regards to whether you can use the waiver for a BAA based on what the HMS and OCR has released, that is a waived requirement at this time. Perfect. And I think that is all the questions that we can go through during this time. Rob, Alex, did you have anything else that you wanted to cover?
No, I think that's it, Sam. Thank you so much. Alex, unless you've got anything else, I think we're at time right now.
Yeah, I think the only other thing I'll add, and I think I can say this on behalf of the entire Well employee base, is that we appreciate all of you, all the work that you're doing, all the work that your staff are doing, helping to treat people, really being on the front line. So thank you for all that you do, and please lean on Well, as we're here to help you. So thank you so much.
Have a great weekend. Thanks for your time, everybody.